Well, let's talk some more about the guidelines for school reopening. Joining us from Abuja studio is Dr. Safia Ojo. She's a public health physician, also a family physician. Thank you for joining us on the program, Doctor.
Thanks for having me.
All right. Are you confident in the capacity of the schools, learning facilities nationwide, and this is to safely reopen for exiting students this period?
Okay, thank you very much for the question. I think the COVID-19 pandemic we know has been for some months now, and students have been at home as a result of this pandemic. But I think a lot of efforts have been put by the government to ensure safe reopening of schools, like ensuring that there are provision of face masks, hand sanitizers, good potable water and soap for washing, so that it will reduce the incidence of infections in these students. And I think the pupil students need to be well informed about COVID-19. We shouldn't assume that they know much about it. They need to be taught maybe a brief lecture on COVID-19 on resumption of school, and they should ensure all temperature checks are being, by health personnel, temperature checks are being carried out to know who has a high temperature, who needs to be, and maybe create an isolation room temporarily for those with high temperature or those students with upper respiratory tract infection. But I believe some states have put up a lot of measures to ensure that there is safe reopening, trying to ensure, even some states in this country has made sure that there is provision of trucks to get water into the schools, in those schools that they don't have adequate water, and to also ensure that there is use of the face masks are made available for all students. I think to a large extent, a lot has been put up by the government to ensure safe reopening of schools.
Do you think that the guideline differs, and this is when you talk about students who are boarders and those who are day students?
Yes, talking about the guidelines now, those ones that are day students, it's easier to handle them compared to boarding, those that are boarders. Because those are boarders, they may need to, when they get to the hostel, trying to maintain social distancing and all that may not be easy for them. But those in the day school, it's easier to adequate monitoring by teachers to ensure the right things are being done, the protocols are being followed, and so as to prevent transmission of the COVID-19 virus. So I think it's easier to handle those in the days compared to boarding students. So the best thing is to ensure that we try to look for a more better way of ensuring those in the boarding student will be well handled to prevent spread of infection of COVID-19. So I think that's what we should do, and we should ensure adequate education of these students is made possible in schools, so that they can know much about the virus, they can know the methods of prevention and how to handle. In fact, they should discipline themselves to ensure that they don't just behave anyhow or come in contact with the virus. So I think that will go a long way. Adequate information in the part of the student will be very, very important. But for boarding schools, well, we know that it's safe. Okay,
Dr. Joe, I was
so
actually
I think
going to say
what we should do is...
Yes, I was going to actually say that there's also a lot of risk, especially for the day students who will be traveling on a daily basis, depending on where their school is. There seems to be a lot of responsibility on the part of the parents and the guardian in that regards, doesn't there?
Yes, for those traveling from one point to the other, like entering on public transport. If you look at the transport, whatever, up till now, they don't even use face masks in some of the cars. So it's a problem. I don't know. We need to ensure that people follow these protocols and ensure that there is a reduction in the incidence of this virus. Make sure when you're entering car, those traveling from one point to the other to go to school, they should ensure they use their face masks, the use of hand sanitizers to reduce risks of transmission of COVID-19. So I think a lot, because I've noticed a lot of persons now don't really use the face masks again. They don't even bother much about precautionary measures taken against the COVID-19 virus. So a lot has to be done. Maybe adequate education. We need to keep informing people about the best ways to keep ourselves safe from this virus. But nevertheless, we know life has to continue, even in the face of COVID-19. Students have stayed home for months, as a result of the virus. The main thing is to ensure we follow the rules and regulations. So it will help to reduce risks of contracting this COVID-19 virus.
Well, I'd like to thank you so much, Dr. Safia Ojo.
The government is... okay.
Thank you, a public health physician, family physician. Thank you for joining us on the program.